Hello, hello. Hi there. Just getting myself a tea. Getting ready to join you today. Hello. Hi everyone. Hi. Hi Nikki. Right. Well, let's get started. So today is Monday again. We've got a new session of Mothering and Matrescence Mondays. And I'm very, very excited and very happy to be welcoming today. My guest is Nikki Wilson. She is the CEO of Make Birth Better, an organization that works on helping create a better birthing experience for everyone. And so Nikki is joining me now. Let me see. Let's see if this technology works today. Yes.
Ooh, hi.
Hi. Oh, half of my face is caught. I just realized. Yes, that's better. Hi, Nikki. How are you?
I'm really good, thank you. How are you?
I'm very good. Thank you very much. Thank you for joining me today.
Very welcome. Yeah, just nipped on here. I've got no makeup on, so I'm just showing up as my true self today.
That's fantastic. That's perfect. That's great. Thank you. Thank you. So I'm just going to make an introduction about what this is about, why we're here today. So I organized this series on Instagram, which is called the Mothering and Matrescence Mondays, which I created coming from my matrescence coach angle. I just wanted to bring light to things that can be challenging for women as we enter motherhood. Some of the topics that we don't expect as we go through this journey, and some of the things that actually can make it harder for us to be the mother, and to go into this new role and integrate this new role into our lives. And definitely birth trauma and perinatal trauma, it's high on that list of things, like experiences that can make challenging for women to adapt to motherhood, to connect to the babies. And so, yeah, I just thought that this is a very, very important topic to talk about, and something that is not discussed and talked about enough anywhere, to be honest, I believe. So please tell me what you do, what is Make Birth Better, what the mission is, and yeah, a little bit about you.
Well, thank you. Thank you for doing the work you're doing. It's so meaningful, and I'm sure you're making a huge difference to so many birthing people. So what do we do? Make Birth Better is a community interest company, and what we do is we're on a mission to end suffering from birth trauma. So we offer support and campaigning and training to healthcare professionals. What makes us a bit different is that we take a very systemic view on birth trauma. Moving my phone, I've got a bit of. Am I echoing to you or just to me?
Not a lot here.
Okay.
I can hear you. Yeah.
So what makes us unique is we are a collective of parents and professionals. So we really believe that, so often in the birth space, in the perinatal world, we're pushed into very dichotomous views. It's either, let's say, for example, perhaps it's the breastfeeding camp or the bottle camp, or it's the vaginal birth or the cesarean birth or so on, and it becomes incredibly divisive. And what we know around trauma is actually working as a collective group of compassionate parents and professionals is how we're going to drive change. So that's us.
Yeah. Okay. This is such an important work and so needed. And when it comes to, I was intrigued really, because when when I thought about trauma, I thought about birth trauma. So
Yeah.
this is kind of my first experience with it. And coming from a personal experience, I had a traumatic birth experience, and but before going into that, why would we talk about a perinatal trauma? So what's that mean?
Yeah, great question. And I'm sorry you had a traumatic experience yourself. So what does it mean? So the words birth and trauma together are not that helpful, because of course we default to assuming it's the birth itself that may have caused someone to feel in some way very distressed or traumatized. And it absolutely is part of the mix. But what we're really talking about is what's called perinatal trauma. And that's what we really mean is at some point in your journey between deciding you want to conceive a baby, perhaps through your pregnancy, perhaps during your birth, or in the weeks, months and years after, so that full perinatal experience, you found something. It may be an event, it may be a series of events that made you feel intensely afraid, fearful, helpless, and that has stayed with you in some way in your mind, in your body, and is something that you're probably still sitting with if your trauma has not been addressed. So yes, we do tend to default to the birth, and we use that phrase because it's become very popularized, and by its very nature, of course, because of the physicality of birth, it can very much be that may have caused someone deep distress or suffering. But there's lots of other things in there too. So of course, reproductive trauma, someone going through IVF or facing an infertility diagnosis or facing pregnancy loss, somebody living with hyperemesis, or other really debilitating conditions or physical health issues. And then perhaps postnatally, we often use the example of feeding, and breastfeeding for a lot of people can be very triggering, can be very distressing and difficult for people too. Yeah,
definitely. And definitely it was one of the topics that it's also kind of high on that list of how someone will experience that first introduction into matrescence, that the birth, and there comes breastfeeding, so both kind of quite important. I had a workshop. I did a workshop about perinatal trauma a few months ago, and something that stuck with me is this thing that I shared on a post a few days ago, which was that trauma is less about what happened and more about how you felt in the experience. And this really stuck with me because that's how I felt about my own personal experience. I felt like when I was talking to people about it, it was like, it doesn't sound that bad.
Yeah.
It's not that bad. And I kept doing this thing of saying, okay, it could have been worse. And at least, my baby was okay. And all these excuses. And then until I hear that sentence, it makes sense, no?
Yeah. Oh, absolutely. And it's probably one of the first points we would make to anybody training with us is, and it links back to Cheryl Beck, as a well-known professor that really writes about this, and how essentially trauma is subjective, and it is nobody's right or permission to say what another person may or may not find deeply distressing. So, and also, when you look at things objectively, it's not predictive of trauma. So someone who had an obstetrically, let's say, straightforward birth may go on to suffer symptoms of trauma. Someone who had an obstetrically difficult birth may not go on to experience symptoms of trauma. So this is where it is always about listening to those individualized stories and focusing on, as exactly, I saw that quote that you put on Instagram, actually, that moment of realizing actually it's my story that matters, is how I felt, or how we felt in that moment or over those series of events.
Yeah, which leads me to can we do something to prevent it? to
Yes.
stop it from happening?
Yeah.
Is there anything?
Oh, absolutely. There is so much. I mean, if you're talking about prevention in the very first place, there's both things that parents and professionals can do. So the key to trauma prevention is creating spaces that feel psychologically safe for people. And it comes back to that. It comes back to what it means to be a human, what it means to feel held, what it means to feel supported, to be seen, validated, and heard.
Mm-hmm.
So, of course, we can prepare for that as parents to be, and really consider what steps we can make sure our voices are heard, that we are seen, that we're safe, that we're actively considering before we go into those scenarios, what makes me feel most safe.
Mm-hmm.
We find that courage to really actively pursue those plans, those environments that we think might make us feel most safe. And we advocate for what we would call trauma-informed birth planning. So really encouraging people to think about what is it that makes you feel physically unsafe? What are your, triggers would be the psychological term, but really actively consider, what does stress look like for you? How does that manifest in your mind and in your body? What coping strategies can you learn to help you manage those situations? And then on the reverse side, or on the other side of the very same coin, is of course the professionals. And we often separate those two things. So many of professionals are parents themselves. They are service users too. They've seen this side. We've seen the story from both sides of this coin, in that it's very much an intertwined story. But for professionals, this has two really important layers. There's one obvious layer, which is about how they can contribute to helping parents to feel more safe, what they can do, particularly around kind of mental and psychological support. But on the other side, and this is the really fundamental kind of systemic part of this story, is that we have to actively look at how professionals themselves are being looked after in their jobs.
Of course.
They are not being well cared for, if they're not being seen and heard and validated, they will find it very hard to hold safe spaces for other people. And because of the state of our health services in this country is so awful, a lot of the struggle that people face with healthcare professionals is actually through no fault of their own. It's because they are not being looked after themselves.
Of course. Yeah, absolutely. Yeah, and that's it. Brings this topic is so big that we could just spend hours just talking about it. But yeah, I think what you said about preparing, about working out, just having that work with yourself, of finding what makes you feel safe, and it's almost also knowing that this could happen, this potential scenario. And I think sometimes we treat pregnant women as not able to cope with that information, and we should, I don't know, somehow make it sweeter, the experience of birth, which is I understand it from a perspective of coming at it without fear, because that helps the birthing process. But it's also not sugarcoating the experience.
Yeah, absolutely. We're just actually writing a new module of training on trauma-informed antenatal education, because there's a lot of nuance in there, isn't there? There's a lot of, and that's where you get into these dichotomies of how we should approach antenatal education. Should we mention this? We don't want to scare people. But there absolutely is a way that you can approach that, and it is by balancing honesty with safety and helping people consider all of the different scenarios they might find themselves in, and then scenario planning for how they can help to keep themselves feeling safe, and also the responsibility of professionals to help in those scenarios too. Of course, there are some situations where you could argue that trauma is harder to prevent than others.
Okay.
So if somebody ends up in an emergency situation, a cesarean section procedure is considered in and of itself, in an emergency scenario, a traumatic experience.
Okay.
So we have to also kind of wrap our heads around that, which is, you know, you are fundamentally putting somebody into a space in some scenarios that are going to trigger them, because the only reason you would put somebody in that space is because you feel that individual or the baby might be at risk.
At risk, of course.
Of course, there are loads of things parents and professionals can do to minimize the impact of those situations on them, particularly mentally. And what we know is when people start telling us their stories and their positive stories of being in those situations, they will be able to cite the one person and what they said that just switched them into a feeling of being much more safe, being much more seen. And often in those scenarios, I've just actually had a brilliant conversation with one of our Make Birth Better champions, who's part of the team of people who manages both elective and emergency cesarean births. And she fully understands that her role, which is about booking people in and preparing the space and having conversations with patients, is fully pivotal in their experience of that time. And it's just wonderful that people, you know, once you really get into these conversations with healthcare professionals, and they understand just how pivotal their small role can be in the experience, you know, you really feel hope, and that it makes me, oh great, I wish I could book everybody into your kind of C-section list, because I know you're going to look after people. So yeah,
it's absolutely, it's amazing how big difference can a midwife or someone just little details, being through it twice at birthing, it's just things that someone holding you, someone asking you like, are you okay, how are you feeling? It's just things that, it's just how little can make a big difference when you're in that space. So I'm just thinking about people that might have experienced, have some traumatic experience at birth or pregnancy, and there are situations that this is not flagged or is not noticed. I know in my experience, my situation was not severe, and it was, I mean, no one ever told me like you need support, or nobody noticed this. And so how can someone know that they've experienced trauma and that they need help?
I'm just going to put my phone over here and try that again. That's not too well, up to 40% of people in this in this country will find their birth, so to focus just on the birth there, in some way distressing.
40%, that's huge.
So I think there's a little bit, you know, from that argument, we believe we should be having these conversations with everybody. So at every point in your perinatal journey, and particularly postnatally, the questions should come about, you know, is there anything you found particularly distressing? Have you considered how that experience might be affecting you? Are you aware of what support is out there? What can you do? So we know that in terms of postnatal PTSD, of all of that bank of people who might have found their experience distressing, about 8% will go on to experience clinically significant symptoms of PTSD.
Okay.
That does not take away from perhaps what you were describing there, Jasmine, an experience that does not meet the clinical significance of PTSD, because what we know is many of those people will go on to suffer one or more of those symptoms. So whilst they might not meet a clinical diagnosis of PTSD, they're very much living with trauma symptoms. So things to be aware of, really, and a part of our role in supporting people is to raise awareness of what those symptoms are.
Exactly.
Yeah. There's 4 quite clear categories to look out for, and this is why, as I come to describe them, they're commonly misdiagnosed as postnatal depression or postnatal anxiety. Now, often there is crossover and they might fit together, but people are frequently misdiagnosed, particularly with PND, instead of trauma symptoms. So you might be experiencing some kind of re-experiencing of what had happened to you. So this can come up as nightmares. It can come up as you see another pregnant person and suddenly you feel your whole body change. I often think of one that's very kind of much stuck in my brain was going out with friends who I'd met through NCT, and everyone started talking about their birth, and that my whole body was straight into panic. I could feel myself not wanting to become hyperverbal and talk about it at length, but actually feeling really fight and flighty in my whole body. Yeah, it can play out in lots of different ways we're experiencing. The second symptom would be avoidance behaviours. So that might look like avoiding those friends because you really didn't want to talk about it, avoiding other pregnant people, not wanting to go back to the setting where you birthed, avoiding the topic entirely and just never wanting to go there. The next one would be negative thoughts and feelings. So this is often very intertwined with PND. So strong feelings of guilt.
Yeah.
So strong negative feelings. So you might be feeling a lot of guilt, a lot of shame. Anger is very common in there, but really kind of deep running sense of perhaps failure or loss. Very negative feelings. Again, I would use my experience here of just fully believing that I would never ever be the same person again. Fully believing that I would literally never be able to leave my town or depart from a very small kind of vicinity. And then the next one, the fourth one, which is really is very common, is what's called hypervigilance, or a very strong heightened sense of threat. That's the bit that basically the best way to describe it is you feel fundamentally unsafe in the world. So you might be much more sensitive to light or to sound. You might find yourself a lot more jumpy, a lot more irritable. And that feels a lot like stress. It feels a lot like anxiety.
Anxiety, I was going to say that, yeah.
Yes, and it is. It's basically your fight and flight mode being whacked up to high, and your body is really struggling to regulate it and bring it back down. So I would describe to people from my experience how I had a very strong sense of wanting to run all the time. I couldn't leave my front door without having a panic attack. This is quite severe, so quite unusual for it to be that strong. But so many things made me feel unsafe. So bright light, being in big shops, being just surrounded by people I didn't know. So that's the kind of fourth thing to be aware of. So so the more we become aware of those symptoms, the more we might have those kind of aha moments. Like, well, actually, maybe there's a bit of trauma going on for me there.
Yeah, and it's like this almost I guess knowing that something's not right. No, I think sometimes we just need to trust that intuition. Because in my case, I remember thinking like, I know I'm not depressed. I'm not. People ask me like if you had like symptoms of postnatal depression. I'm like, I'm not depressed. I know it's not that, but there's something off. It just doesn't feel right. It feels okay. Yeah. So it's that's just knowing that there's something. And what to do then? So once you know, okay, there's something off. What help do I need?
Yes. So because these kind of questions around trauma are not well integrated into the support that we're given by default, so they're not currently well integrated into your questions you might be asked postnatally by a health visitor or a midwife or a GP, and we're really working to try and change that, and there is some change, but it's slow, particularly in those professional groups. It does then land on the parent to really try to articulate this to a healthcare professional. So again, we're working on a new resource for people. It's kind of a PDF download basically to say I'm not okay and I don't think I'm depressed. So that was that very same. I think that's a very common theme for people, at least initially with trauma. They may not feel depressed. Often they become depressed because their symptomology is not being taken seriously, or they're misdiagnosed and not given the right treatment. So if you can advocate for that to healthcare professionals and use the words around, you know, something from my experience is I'm finding very distressing, it's very much sitting with me in my mind and my body. There are services out there to support people. So whether it's coming to voluntary services like ours at Make Birth Better, we have loads of support resources, loads of signposting. The Birth Trauma Association actively does a lot of support work around birth trauma as well. Mm-hmm. And then within healthcare services in this country, there are specialist midwives. So if you're preparing for pregnancy or birth, there are specialist mental health midwives who are much more aware than they used to be around birth trauma, which is great. Yeah. There is loads of funding just gone into trauma and loss services in this country. So there are now nationwide in England trauma and loss services for people who are suffering from trauma. Mm-hmm. Mm-hmm. So that's great. So trying to find there. There are perinatal mental health teams across the UK. But what we do know is often getting into these services because you're perhaps not severe enough, perhaps the waiting list is very long, can be really hard. Of course. So there's no magic answer to that. And of course there are private healthcare options that you can pursue around therapy and counselling. At the moment, from NICE recommended treatments are trauma-informed CBT. Or EMDR. Antidepressants are also signed off through NICE as a validated evidence-based treatment that can support people, particularly if they're already having therapy. And then, of course, there is a whole plethora of healing techniques that people will find over time, often through a test and learn of like, oh, actually something will really click for people, be it journaling, be it nature connection, be it trauma-informed yoga or Pilates or moving the body. There's a lot for people in that. So, you know, we signpost the evidence-based treatment, but at the same time, there is a lot of anecdotal support for loads of different holistic support to people with trauma as well. Yeah, and it's not. It's there's light at the end of the tunnel. So I was going to say, so it can be fixed. It will. People get better from this. Yes. Right? So yes, absolutely. Healing is not linear. You will know that yourself. It's a process. I know when I had my daughter, she was my third. Almost 2 years ago, spent almost a decade really having to work hard at rebuilding my life. And actually the pregnancy was straightforward, the birth was an elective cesarean, but when they wheeled me into the same room where I'd had my birth traumatic experience, I didn't say anything because I actually thought I had healed enough to be able to sit with that and not go down the kind of rabbit hole of trauma. But within hours I was really triggered. I was really reliving my experiences, and that took me massively by surprise. I think, this is really, you know, important for people to know that it's not linear and can come back to surprise you. What I would say is there are some people, if people are already living with complex PTSD, complex trauma coming into this, and birth trauma or perinatal trauma is a layer in their story, of course their likelihood to heal, whatever we mean by healing, may face setbacks because they're likely to be suffering in a ton of different ways. So if you are a case, it sounds like you and I, where our diagnosis is relatively clean, you know, it's likely we will have had other trauma because everybody does. but speaking from experience of going through therapy, still being in therapy, still taking antidepressants, that has been enough for me to feel that I really healed.
Yeah.
They say that the more complex someone's story, the more support they will need, and healing will take more time and need more support.
Yeah. Of course, absolutely.
Too, yeah.
Yeah, and there's so many layers as well as to this experience, and with matrescence and birth and everything, it just brings you back to that connection of your past, your childhood, your teenage years, you name it.
Yeah, you relive your own experiences through your children, and that's something which is amazing and terrifying and triggering all at the same time, right? So it's
so much work.
Yeah, it's so much work, and but the more work we put in, and one of our co-founders, Dr. Emma Sandberg, has just released a brilliant new book actually called Parenting for Humans, but it talks to this. It talks about unpicking all of the things that might be throwing us off piste as we parent, you know, moving on from the perinatal journey and looking at all those other considerations that might be affecting us really deeply. So yeah, it's layered and complex and bonkers and beautiful all at the same time.
Exactly. Okay. Well, thank you so much, Nikki. I'm just we're coming to 1 o'clock, so thank you very much. Thank you for joining me today, for sharing this, and just so people know where so Birth Better, where can they?
Yeah, thank you. Yeah, of course, come to on Instagram, come to @birthbetter. Our website is www.makebirthbetter.org. If you want to ask us anything, DM us, send us an email, hello@makebirthbetter.org. We'll answer anything, any questions, any signposting, any kind of what do I do now, queries, you know, please reach out and join the community.
Beautiful. Thank you so much for your work. Thank you so much for being here today.
Take care. Thank
it's
you.
been lovely. Thank you very much.
Thanks, Jasmine. Bye.
Right, everyone, thank you for joining us today. That was Nikki Wilson from Make Birth Better. A very interesting conversation about perinatal trauma. I will put this in my grid so you can rewatch it if you didn't watch it the whole live. And yeah, join us next Monday for another Mothering and Matrescence Monday. And thank you. Have a nice week.